I'm Dr. Verna Thornton. I'm a board-certified OBGYN with almost 3 decades of experience taking care of women and unborn children and delivering them and doing surgeries as well. So I do have a fair amount of experience with respect to healthcare of women. I'm not here to talk to you today about all the deluge of data relating to COVID-19 in the general population, but rather to speak to you if you are a woman of reproductive age and as well as if you are currently pregnant. Right now, there are a lot of women who are very afraid of what is to be with their course of their pregnancy during this pandemic. And one of the things I want to relate to you is that there have not been any really good studies now to discuss the long-term effects of women who have had COVID-19 and the possibility of, its outcome with their children. So far, studies have suggested that there is no vertical transmission between mother and unborn baby. And what that means is we do not think that if a mother who is pregnant and contracts COVID-19, that it will automatically spread to the baby. We do not think that. However, we do know, and there have been some, suggestions that women who do contract COVID-19 do tend to have some level of decompensation after delivery. So that's why it's so important that we make sure that our pregnant women do not get and contract COVID-19 during their pregnancy. So social distancing, again, is extremely important. This also poses a level of difficulty in as much as we know that many of our pregnant women work outside of the home. And we know that several of the women who are people of color are doing the hard and heavy lifting in jobs that mandate that they're essential workers and are present in the public sector, such as our service industry, such as nursing assistants, public transportation providers, and so forth. So if you're in one of those positions in employment and you're pregnant, I would really urge you to really try to practice as much social distancing as possible, and to certainly, when you do get home, practice all the best hygiene methods known, such as washing your hands, such as dropping your clothes at the doorway and washing them separately from that of your family. Again, being very cautious about eating out and the receptacles that you use in terms of the bags that the food is transported in and so forth, because we know COVID-19 can be transmitted by non-human contact. In other words, by either food or in terms of the packaging that it's in. Also, with our children, we have to be very careful. If you have other children at home, we do need you to be very, very diligent with regard to their practicing social distancing as well. And last but not least, there's a great fear of women as to who's going to be there as my support system when I'm in labor. And I would urge you to look into your own healthcare provider and hospitals to see what their policy is, because we do know that, locally as well as nationwide, policies do vary from hospital and from birthing center to birthing center. So that's pretty much what I would have to say to women is be careful, eat well. This should be a joyous time in your life. I would not overly, obsess about getting this COVID-19, especially if you do the right things, socially distance, practice good hygiene. And again, information is power. Power is using that information to your well-being.